So what I'm going to do today is talk to you about building resilience, specifically how you and your loved ones can prepare for change in the setting of pulmonary fibrosis. The reason that I'm here talking with you is because I love interstitial lung disease, and you'll find that I use the word interstitial lung disease and pulmonary fibrosis as a common term. I'm a nurse practitioner at the University of Alabama at Birmingham. I've been working there for almost 25 years in pulmonary medicine the whole time. I got my bachelor's degree at UAB, my master's degree at UAB, and my PhD at UAB. My research interest is actually factors affecting quality of life and interstitial lung disease. So I'm thrilled to be here today to talk with you about this important topic. So in talking about preparing for change, why bother? Why bother preparing for change? No one wants to be blindsided. When you think about the major life events that you've had, maybe your schooling, your career, your spouse, children, all of these things took a great deal of preparation. But here you are with a diagnosis of pulmonary fibrosis, and I would argue that that came as a bit of a shock with no preparation. And that may leave you feeling fearful, completely unprepared. How are you going to make this transition? With preparation for potential changes you're going to face in your life, you're going to be better able to navigate your journey, to dictate your journey with pulmonary fibrosis. So as we talk about tools for change, we'll do so in the context of, first of all, understanding the nature of change itself, the barriers that are commonly experienced when we're faced with change. We'll talk about change specifically as it applies to chronic illness, the importance of planning in this setting, and then we'll focus in a lot on tools for change. So to begin with, why is change important? You've heard the saying, the only constant in life is change. And there really is some truth to that. Change isn't all bad. There are some positive attributes to something as terrifying as change. It can teach adaptation. It can help us develop a sense of resiliency. But this is only possible if you are able to understand your capacity for learning, for growth, and for change. As you acclimate to change, it helps you develop flexibility in life. It allows you to gain confidence as you navigate through change proactively. And this can result in a sense of personal growth. So change doesn't have to be terrifying. There are positives from change. As you can imagine, there are barriers to change. One of the largest barriers that we see is the resistance to do something different than what we're used to. We, for better or worse, are creatures of habit. We take a lot of comfort in knowing what's going to happen, what the outcome is likely going to be, what we can expect. Fear of the unknown is such a barrier with change. There can be uncertainty about the future, and certainly with an unpredictable disease, this can invoke a big sense of fear of the unknown, leaving you feeling completely unprepared. But the reason that we're here today talking about this is that you are able to prepare for potential changes that you may face in your life. And with that preparation comes empowerment. You will be the director of your journey through pulmonary fibrosis. When we look at change in chronic illness, it's a little bit different from change in kind of your regular daily life. When you receive a diagnosis, it's usually reviewed as a negative life-changing event, and it can have physical implications, it can have implications on your relationships, your emotions, and ultimately change related to chronic illness is going to ask that you come to terms with a new set of life circumstances. It's going to ask that you seek out new senses of purpose, and you might need to reassess your priorities. To acclimate to change, to be the leader of change, to have change in your life and you direct that change is going to take planning. Planning gives us a sense of control. Planning gives us more mental preparedness in the face of uncertainty, especially when you're given a diagnosis and you might not know that disease trajectory. Planning for the future can give you that sense of control, that sense of mental preparedness. You know, when a plan is disrupted, it often results in negative emotions and feelings, and this can cause a great deal of conflict that can be mitigated by preparing for change. And change will continue to happen, but let's prepare for it. So how do we do this? How do we prepare for change? Change that we don't know exactly what that's going to look like in the future. Well, there are things that we know that we can look towards. The first thing we'll talk about is knowledge. Get the facts about your disease. Another tool for change is anticipating potential physical changes that can occur with pulmonary fibrosis. It may seem like an obvious thing to do, but focusing on a healthy lifestyle is equally an important tool for change. Financial considerations are often not prospectively looked at, but that is a tool for change to help you acclimate. Establishing coping strategies, and I would tell you this right now, you don't have to have just one, and your coping strategies may be very different from your loved one's coping strategies, but I challenge you to find those that work best for you. Also, reviewing your goals and priorities is so important in preparing for change. Advanced care planning is something else we're going to touch on because it's often overlooked. And utilizing the resources at your disposal. These are all tools to help you with change. So getting the facts, where do we start with this? Well, let's get the facts about your diagnosis. How are you diagnosed? What type of interstitial lung disease do you have? You know, it's not enough to say, I have ILD or I have IPF. All ILD is a big umbrella, and underneath that umbrella are almost 200 different conditions that cause interstitial lung disease. Each can have a different prognosis, a different treatment regimen. So find out, what type of ILD do you have? How's the diagnosis made? Are you going to need a biopsy? And what's expected to happen in the future with it? Now, in terms of treatment, you'll want to ask your providers what type of medications may be at your disposal to treat your disease. Are you going to take antifibrotic medication? Are you going to take immunosuppressants? Is there medication to treat your type of interstitial lung disease? What side effects are associated with these medications? Are you going to have to monitor for gastrointestinal side effects, diarrhea, poor appetite, cramping? What about your immune system? Are you more at risk for infection based on the medicines you're taking? What about non-pharmacological treatments? Ask your providers what else can be done to treat your disease. There are other interventions such as pulmonary rehabilitation. That's a wonderful non-pharmacological treatment for pulmonary fibrosis. And what about clinical trials? Are you a candidate for clinical trials? Now, prognosis is perhaps one of the most important bits of knowledge that you can get about your disease. You'll want to ask your provider, how severe is your disease? How can it be expected to progress? Are you having progression? Ask these questions so that you can prepare for what might be coming. Also, you'll want to ask your provider about monitoring. How often will you need to come to clinic? What testing is going to be done when you're there? Will you have a breathing test at every visit? What about a walk test? What about an echocardiogram? What kind of things will happen when you're in clinic? Incidentally, the reason that we put you through that horrendous pulmonary function test every time you come is it gives us a very good idea of how your lungs are being affected by the pulmonary fibrosis. So when you're sitting in that PFT lab and you blow it out, keep going, 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 and there's nothing left. That's essential information that helps us as providers understand where this disease is going. We also want to monitor for complications related to pulmonary fibrosis. Ask your provider what's being done about that. We might get an echocardiogram to look out for the development of pulmonary hypertension. We'll also want to make sure that your comorbid conditions or other medical conditions that you're dealing with are under good control. Pulmonary fibrosis alone can cause a great deal of shortness of breath and cough. But if you also have COPD or emphysema and it's not being managed appropriately, that's like pouring gasoline on a fire. We want to make sure that it's being treated. If you have congestive heart failure, we'll want to make sure that that condition is optimally managed so that it's not also contributing to your shortness of breath and your cough. The second tool in the toolbox for preparing for change with pulmonary fibrosis is anticipating potential physical changes that can happen down the road. The first is going to come in terms of disease effects. Now, it's not uncommon at all for people with pulmonary fibrosis to have a sense of breathlessness, cough, fatigue, depression, anxiety. In fact, we know that with a certain type of pulmonary fibrosis called IPF, 1/4 to 1/2 of everyone with IPF has some degree of depression. And up to 60% of the people with IPF have anxiety. And these are just the people that report it. The number's probably much higher. Another physical change that you may experience is a change in your activity tolerance. You might find it difficult to do the things that you commonly do. It might take you longer to get from point A to point B. But preparing for this change, you can acclimate and change some other aspects in your life to try to do the things that you want to keep doing. Other physical changes that can occur have to do with medications and treatments that you take for your pulmonary fibrosis. You might have side effects related to your medicine. Like I said before, GI side effects like poor appetite, diarrhea, things like that. You may have side effects or physical effects from other treatments for your pulmonary fibrosis. You know, some of you are on oxygen, so you're well aware of the physical change that comes with putting a nasal cannula in your nose, going around your ears, going all the way down to a tank of oxygen or a concentrator, and having to lug that around. As you can imagine, planning for a doctor visit, a trip to the grocery store, a vacation will take a great deal more planning. It's not impossible, but it takes planning. So being aware of the physical changes that can occur with pulmonary fibrosis allows you to address it before you're blindsided. The next mechanism to help you deal with change is focusing on a healthy lifestyle. And this seems intuitive, but it's so important. The first thing involves diet. Make sure you're eating a healthy diet. Fruits, vegetables, whole grains, lean meats. You know, oftentimes we're asked by our patients, what kind of diet should I be on? What about an anti-inflammatory diet? Unfortunately, we really don't have data that tells us that's the right diet for anyone. But what I would tell you is that for most people, a heart-healthy diet or a Mediterranean diet confers some benefit. It's very healthy. So talk with your provider about what diet might be best for you. And also realize, with disease progression, you may find it difficult to sit down and have 3 square meals a day. You might need to start having smaller, more frequent meals. And try to avoid the abyss of being too underweight or too overweight. If you're losing too much weight, your body's not getting enough calories. And if it doesn't have enough calories, it finds it very difficult to do the job that it needs to do to get through the day. You're going to be more symptomatic. On the other hand, if you're overweight, taking in too many calories, you'll gain weight, and this is also going to worsen your sense of breathlessness. So trying to maintain a healthy weight through diet is essential. Sleep is another important aspect of a healthy lifestyle. And I wish I could sleep appropriately because it really has far-reaching effects. Number one, it can improve your overall sense of well-being, and it can boost your immune system. Getting adequate sleep is very important. Now, exercise. You might be sitting here thinking, what are you talking about? I can barely breathe. How am I supposed to exercise? One of the most devastating consequences of pulmonary fibrosis is the sense of breathlessness that can occur. This in turn causes people to become less active. So physical inactivity is a result of feeling breathless, and it turns into a vicious cycle. The more inactive you are, the more difficult it is to get up and do things. So please exercise and stay active. There are several mechanisms to do this. One such mechanism is pulmonary rehabilitation. Pulmonary rehab is a monitored, structured exercise program that is specifically tailored to your needs with the goal of improving your functional status, teaching you how to breathe with pulmonary fibrosis. And we know based on research, that pulmonary rehab for individuals with pulmonary fibrosis improves breathlessness, sense of well-being, and improves depression scores. I recommend, if you have this at your availability, please, please, please participate. Ask your provider about it. Is there a pulmonary rehab in your area? Now, the next thing to do to maintain a healthy lifestyle is to prevent respiratory infections. You know, a respiratory infection that some people would get that's no big deal could have a devastating impact on your life with underlying pulmonary fibrosis. So talk to your provider and get vaccinated against those common illnesses that are available right now. Also use common sense. Don't go out into giant crowds when it's in the middle of flu season in your area. Wash your hands frequently. And reach out to your provider if you start to have worsening cough or shortness of breath. I don't want you sitting at home for a week or several days trying to think, maybe it's a sinus infection. Maybe I wonder if I'm having disease progression. What is this? Call someone. Call your provider. They'll bring you in. They'll work it up. But stay on top of it and let someone know if you have symptoms of an infection. The next tool in the toolbox is something that people prospectively don't think about right away when they're diagnosed with pulmonary fibrosis, but it's financial considerations. Believe it or not, I know this is a far reach, but chronic disease has been equated with financial burden, and this can happen for a variety of reasons. The first thing you'll want to think about is your employment. If you're still working, are you able to continue working in your current job, in that current capacity? Do you need to take on a different role in your job? Do you need to decrease your work hours? Is disability a consideration? These are things that you should talk to your provider about. And regarding insurance coverage, be very familiar with what your insurance covers. Know what your co-payments are going to be for clinic visits, for testing. Be very familiar with the insurance coverage. And also the implications if you're no longer able to work, and that's where you get your insurance. That needs to be figured out. And if you have the resources, talking with a financial planner about financial concerns or issues in the setting of pulmonary fibrosis can be extremely helpful. And again, staying ahead of the curve. Coping strategies. Remember, I said there are going to be a lot of them. I hope you pick more than one, but find something that's going to be effective for you. And your caregivers might have a totally different set of coping strategies. The first strategy is simply to talk with family and friends. You know, your initial inclination might be, I want to protect my family from any negativity. I'm fine, everything's fine. But letting people in not only allows you to get your feelings out, but it also empowers your family, your friends, your caregiver to be able to share those emotions too and connect on that level. Some people find that journaling is effective. Journaling is not talking to another person. I say it's throwing it out to the universe. You're getting everything in here, out on paper. No one has to read it but you. But it can be cathartic to do that. Some people will never journal. If you've never tried it, I'd encourage you to give it a shot. Exercise, exercise, exercise. It is a coping strategy. At its very core, you release endorphins when you exercise, and these things make you feel better. And again, you can exercise even if you're on oxygen. Talk to your provider about mechanisms to do this. Hobbies, 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 hobbies. What is it that makes you happy? Do you like to tinker with a car in the garage? Do you like to work on cars? What about gardening? What about visiting with your family? What are your hobbies? Please continue to pursue these. I tell my patients, chase your happy. And sometimes we have to reframe that in the setting of pulmonary fibrosis. I'll give you an example. One of my patients, her happy is gardening. She's gardened her whole life. She got to the point where she couldn't go out and garden because she couldn't lean over and pull weeds and get the seeds in and harvest. So she found it difficult to chase her happy. Well, fortunately, her grandchildren are handy with woodwork, and they built her raised beds. By raised, I mean like belt height, so she can walk out into her garden and not have to bend over. So she's still able to chase her happy in that way. But the important part is she was able to reframe it in the context of her lung disease. So find your hobby, chase it. Counselors can be very effective coping. They can help you get out what's in your head, your hopes, your fears, your frustrations, your worries. It's a neutral third party. You're not related to this person, but they can help you make sense of the emotions that you're having. Support groups are a wonderful coping mechanism. Support groups, it's wonderful for individuals with pulmonary fibrosis as well as their family members. Support groups offer an opportunity for you to realize that you are not the only one in the situation, that while your journey with pulmonary fibrosis is unique and your own, there are other people traveling a similar path. You might learn tips from them that you hadn't thought of before, that we haven't thought of before. On the other hand, you might teach someone tips that you've learned with this disease. Support groups are a wonderful, wonderful coping mechanism, and it makes people feel less alone. The last part of coping that I want to talk about is advocacy. And please know, this list is not all inclusive. There are many other coping strategies, but these are some of the more common ones that we see. But the last one I want to talk about is advocacy. 2 forms of advocacy. Number 1, advocate for yourself. You are the single most important person in the care team. It's not your physician. It's not your nurse practitioner. It is you. You are the cog in the wheel. You are the most important person. You advocate for yourself. You speak up for yourself. If you're not feeling well, if you're finding it a little bit harder to walk to the mailbox, don't keep it to yourself. You're not doing anyone any favors. Advocate for yourself. If you're having issues with a medication, advocate for yourself. You are your best advocate. Use your voice. The second form of advocacy comes in advocating for others with this disease. And I hope that you've experienced through this conference, through the PFF, that there are a lot of avenues to advocate for others with pulmonary fibrosis. And if you're interested, reach out to, PFF, for example. But you can advocate for others with this disease as well. And that can be very empowering. Also, volunteer work can also restore a sense of purpose for some people dealing with this serious medical illness. So there are a lot of coping strategies, and please, please, please don't just pick one. Pick whatever works for you and employ that in your daily life. The next thing that's really very important in planning for change is reviewing your goals and priorities. Focus on what brings you meaning and purpose. Oftentimes, people that are diagnosed with a serious medical illness, this diagnosis kind of brings into focus the things that are important to you, the relationships, the people, the things that are most important to you. Run with that. You know, when we talk about setting goals and managing expectations, they occur hand in hand, okay? So be realistic when you're setting goals. For example, if you start the day with a to-do list that is a mile long, you might be setting yourself up for failure. Please set yourself up for success. And sometimes, in the context of pulmonary fibrosis, you'll need to reframe your goals, your priorities. I'll give a personal example of this. My father-in-law, he lived with a progressive pulmonary disease for several years, and he loved golf. Actually, when he moved from Ireland, he was given the option to move to New York for a job or Alabama, and he figured he could play golf more in Alabama, more days out of the year than New York. So this is how much golf meant to him. And he couldn't play anymore because of his lung disease. And he took this all or nothing mentality, all or none. I can't play 18 holes, I'm done. Well, as you can imagine, this resulted in some depression. And after a while, his buddies and his wife got together and said, what can we do about this? So what they did is decided they're only going to play 9 holes of golf. Well, that lasted for a little while. As his disease progressed, he couldn't do that anymore. So his buddies changed golf courses to one where he could drive the cart all the way up to the ball. He didn't have to walk except to step out of that cart and hit the ball. And that worked for a long time. My point is, he had to reframe his goals in the context of what he was able to do, but he still went after it. So when you set goals and priorities, be realistic and don't take on an all or none mentality, please. And most importantly, share your goals and priorities with your care team. Share your goals and priorities. If you do this, then we're all working together, we're all in alignment to make sure that we're meeting your goals. I had a gentleman who I take care of with IPF, and his love, his goal, dancing with his wife. They've been doing it for over 45 years. Several nights a week they go dancing. Not disco, not crazy swing, but they dance, and that's their thing. They're happy. Well, he started taking medication that made him have a lot of diarrhea. Couldn't leave the house. We gave him medicine for the diarrhea. It didn't really help. We changed medicines. It didn't really help. So we talked about the risks, the benefits of him stopping his medication. And in alignment with his goal to be able to go dance with his wife, decided to stop it. Now, if he hadn't shared that goal with us, he'd probably still be in his house going to the bathroom all day, because he would have done that to take the medicine. But it wasn't in alignment with his goals. So please share your goals with your care team and those close to you. So reviewing goals and priorities, when we look at goals of care, it's a tough discussion to have sometimes, but involved in that discussion are you, your caregiver, and the provider. And to have that discussion, you need knowledge of what's going on with your interstitial lung disease. How is your disease progressing, if at all? Are you responding to treatments? Are you having side effects? What is your symptom burden? And then we're going to dig even deeper and get a really good understanding of what your hopes, your dreams, your fears, your goals are. And the goal of this, again, is to make sure that what we are doing as providers is in alignment with what your goals are. And this discussion can happen as often as it needs to, and it often changes. It's not a static thing. So another important aspect of planning for the future is advanced care planning. This is different from goals of care. This is planning for what to do if you're not able to speak for yourself. For example, would you want to be put on a ventilator? Do you want to have CPR performed on you? These are really tough considerations, and they're debilitating decisions for family members to have to make without input from the most important person, and that's you. Advanced care planning means that the decisions that are made are based on your values and your preferences. There was a project called the Conversation Project, and it was about having tough discussions at the kitchen table. And 90% of the people that were surveyed said that talking to your loved one about end-of-life care is important, but only about a quarter of the folks had done so. Almost everyone thought it was important. Not everyone does it. 60% of the people that were surveyed said that making sure that their family wasn't burdened by making these decisions was extremely important. But more than half had not yet relayed their wishes to their family. These are important conversations to have. So, utilizing your resources. This is how you can Navigate your way through change effectively and not feel blindsided. Talking with family or friends, talking with your healthcare team, getting enrolled with a support group, and palliative care. Palliative care is another mechanism that can specifically help you improve your quality of life. And there was a publication that came out just last week from the Hartford group that interviewed, I forgot how many people, people over 50 without a serious medical illness. And it talked about their wishes for treatment if they had a serious medical illness. 99% of the people that they asked about serious medical illness said that they would put a priority on specialized medical care to help ensure quality of life. The goal of palliative care is to improve quality of life. Now, palliative care isn't just quality of life isn't just how good or bad someone's life is. It's how symptoms, physiologic function, your psychological functioning are all affected by a serious medical illness. And palliative care serves to improve quality of life by attending to symptoms such as shortness of breath, cough, fatigue, depression, anxiety, deconditioning. Palliative care is available in many places, and it is indicated for anyone with a serious medical illness at any point in the disease trajectory. Not at the very end of the disease. Hospice is great when you're at the end of life, but palliative care can occur at any other point, and can help improve quality of life. Talk to your provider about it. Summary. Change is inevitable and often viewed in a negative light, particularly when it's involving a serious medical illness. But preparation equals empowerment. Learn about your disease. Learn all about your disease. Knowledge is power. Find the coping strategies that work best for you. Talk to other people. You might get tips that you didn't even think of before to help you cope with the disease, to help you manage your symptoms. Establish goals and priorities and share that information with your loved ones and your care team. And don't ignore advanced care planning. Advanced care planning is exactly what the name implies, planning for your care in advance when you're not able to speak for yourself. And consider palliative care as a tool for change. It can help improve quality of life. And remember, if you're able to employ some of these tools to help prepare for change, then pulmonary fibrosis hopefully won't be something that has you, it's just something that you have.
I thank you for being here today, and I appreciate your time. I know it's really busy. But I want to go back a little bit and imagine that it's the autumn day. A 13-year-old girl was dropped out by her mother to go to school for the very first time. It is a new school, and she is very new to the school and doesn't know anybody at all. Everything is different, and she's not accustomed to this culture. 2 months earlier, she was an immigrant to the US to join her family and her parents in Los Angeles, California. She did not have a good command of English language, and it was difficult for her to make a personal conversation with people, not to mention making friends. But she persists, and she tried, and she engaged in all the activity that is required of her at the school. She managed to make some friends, but there are some who were not so friendly with her and had a false equivalence, thinking that because she didn't speak a lot of English, she might not be that intelligent. So adjusting to a new way of life in a foreign country is challenging for anybody, and to learn a new language is really challenging. But it is even more traumatic for this 13-year-old girl who's trying to make a home for herself. So she managed to make friends, but she got bullied just like any kids, at that age in a new environment. But she was trained as an athlete and got involved in a few physical fights and was able to defend herself. She moved on and graduated from middle school, high school, and college. She fulfilled her dream to become a nurse, a wife, a mother, a teacher, and a nurse scientist, and doing important work to help patients and family members and also her colleagues. So she's here today, 13-year-old, just a little bit older than 13-year-old. So the point that I bring this issue up is to exemplify that as life, we experience pleasant and unpleasant experiences. And it's upon us how we want to make sense of those experiences, whether it's chronic illness or something that's really pleasant and happy. And how do we make sense of it? How do we build resilience around it? And how do we understand it? And how do we move on with life and live with it? So I'm here to share with you about my life journey and also my career journey to where I am today. So what is resiliency? There are two definitions of resiliency that I want to bring up. The first one is the ability of something to return to its original shape and form after it's been compressed or deformed. The second definition is the ability to recover from or adjust easily to adversity or change. So we talk a lot about change in your chronic condition. Change in your body, change in how you feel, and change in how you breathe, or how you even do any interaction in your daily activity. So it is a change. But it's the idea of whatever that caused that change, whether it's a situation or things, or that compress your shape, your form. The resiliency is what we need to get ourselves whole again. So that is the goal. How are we going to get there to get whole? Now, I want to challenge your thinking above and beyond just getting back to that same shape of wholeness. Is it possible that these experiences can challenge you to grow, to be better at yourself in how you manage life in every twist and turn that you have? So there's possibility of that personal growth that we may or may not be able to be aware of until we get into that situation. Now, for me, it took me several years to adjust, and I have help along the way to really get myself to where I am today. But more importantly, I've learned that many tools that I can use to help myself to get into the situation. So what we want to do for the next time, 30 minutes or less that we have, is I would like to go over about the health benefits of mindfulness meditation practice. So we're going to be doing some of that later on today. And I want to describe the connection between mindfulness practice and resiliency. And the third one is when people ask a lot, is there a difference between meditation and mindfulness practice? The fourth one is we're going to do a little practice. And we'll get into the gentle body movement and also mindful meditation based on my research of what works for a patient like yourself who has difficulty in breathing. So what are the health benefits of mindfulness meditation? Clinical evidence for many, many years, I would say about 2 decades long, have demonstrated that it has relating to the better health benefits and well-being. We consistently observe that there is a reduction in depression and anxiety among patients who practice mindfulness meditation consistently over time. And the benefit is not only just in, general population, but patients with chronic health condition as well. Now, mindfulness meditation or mindfulness practice also influences biological processes that's going on in your body. We observe reduction in cortisol level, which is a key biomarker for stress in your body. Some systematic review have also demonstrated that it can actually influence the length of your telomere. Telomere is part of your DNA that usually decreases in size as we age. And we think it might be related to stress and inflammation in your body. So consistent mindfulness practice or meditation can help in delay the shortening of your telomere of your DNA. So that's a good benefit. So the practice not only helps you emotionally, it helps you physically as well. And it may even help you in your spiritual growth, as I alluded to earlier. The key thing is that you don't have to be religious to practice mindfulness meditation. It's not required. One thing I want you to keep in mind is that the tradition of meditation and mindfulness practice derived from the Buddhist tradition, which is Eastern religion. The concept behind that is about practice. It's about preventative health management approach, not to fix things like in our Western society think about. So it is mindful to, it is helpful to keep that in mind as well so that you are patient with yourself in how you, to look at the practice. But more importantly, it is helping you in your emotional regulation. People who practice mindfulness longer tend to have more engagement in the frontal cortex of your brain and less activation in your amygdala area or your animal brain, so to speak, where you react to a lot of things without having that cortical control or cognition awareness of your stress level. So there's some evidence to even show in differences among practitioner and non-practitioner as far as the functional MRI result is concerned. So what are the connections between mindfulness and resiliency? So I've talked to you a lot about the mindfulness and the benefits of it, but I'm curious to hear, what do you understand what mindfulness is from the audience? Because that's a common term, right now. What do you think it means to you? Being in touch with yourself. Thank you. Yes, ma'am. In the moment. Yes. Yes. Yes, ma'am. Calm yourself. Right. Calm yourself. Be in touch with yourself. Be in the moment. You are right on track. And this is the definition that has been defined by Dr. Kabat-Zinn, who is sort of the creator of this practice. It is the ability to stay focused or be aware of your thoughts, your emotion, your bodily sensation in the present moment without judgment. So the key part is without judgment. Because naturally, we as a human tend to think things and look at things in a negative context. So being aware without being judgment, putting or adding labels or being judging to people or things that you notice in front of you is really, really helpful. Because, we might say things like, look, oh my gosh, she's so fat, she must be eating a lot. He's on oxygen tank, he must have been a smoker, right? So those are the things that sometimes inadvertently pop up in our heads. They don't speak English that well, they must be really stupid, So it's just the way the brain works. So being aware of how those thoughts come into your consciousness is helpful. And we'll talk a little bit more about that in a little bit. And it is a practice, right? I want you to think about it as a practice. It doesn't happen overnight. It's a mental health practice, just like a physical health practice where you get vaccination to prevent you from getting any infection, or you take a bath because you want to prevent your body and keeping it clean, maintain the skin structure to prevent you from getting microorganisms. It's sort of like that. So it is right. It's being aware. It's to be noticed about things around you, in front of you, inside of you, and outside of you. Because we simply notice and stay aware without judgment, we give ourselves that space and time to respond to things rather than react to things. Because we have fewer labels, to be labeling to our thoughts and our feeling, we become more accepting of things and feelings and things that people said, things that people didn't say. You know, we don't want to give flavor to it. It's not narrative. It's just simply notice things as it's come along. So what's the difference between mindfulness practice and meditation? What are the key differences? This is the comment that I get most often when I talk to people. Now, we know that mindfulness is being aware of what you're aware of in your thought, emotion, and your body sensation in the present moment, not yesterday, not tomorrow, but right here, right now, without any judgment. Meditative practice is a little bit more intense than that. It's the discourse or a discussion about your contemplation about life, about heavy stuff. So there's also internal dialogue in your meditative practice that's going on for a certain purpose. And commonly, it would be a purpose about addressing the question, what's life? Why am I here? What am I doing here? Why am I a nurse? Why am I working? Why do I have pulmonary fibrosis, right? So those are really interesting questions to ask, but you don't always get the answer. You may, but you may not. But that's not the purpose of mindfulness practice, okay? So those are the key differences. You might choose to practice mindfulness sitting down, similar to the meditation pose, but you don't have to practice mindfulness sitting down. You can do it lying down, you can do while you're walking, you can do any activities that you choose to do. So it has that some connection, but some differences in how we approach it. The goal is for you to notice things and to sharpen your awareness of things and thoughts around you. To have an understanding or better clarity to what, how, and why of its existence, okay? So another thing I want to kind of touch base on is mindfulness is related to your autonomic nervous system and how you relate to your environment. So if you're in a stressful environment, generally your fight or flight would go up, and then your rest and digest autonomic system will be down. So there'll be a lot of cortisol charging. You know, if a bear is attacking you, for example, you need that cortisol, you need that rush of glucose so that you can run away. Okay, so that's an actual stressor, things in front of you causing that, and that serves the purpose. But now we live in a society, we don't really run away from the bears. A lot of our stresses come from thoughts, maybe internal stressor or external stressor. I mean, you could be driving on the highway and get stressed. So what we need to do is to be able to balance the two systems in a more balanced way. Knowing that, you know, the sympathetic always go up and parasympathetic down here, but when you meditate, you kind of adjust the seesaw to a more balanced level, and that can help you maintaining your balance in your body physiologically and emotionally. So that's the definition and the differences between mindfulness and resiliency. So as I said, you can do mindful eating, mindful walking, and mindful listening as a practice. And you can incorporate all this into your daily activities. But it might be daunting for you to get started to do all this, right? But we can do some a little bit practice, and you can see how it is easy. And the point of it is not to start big and expect result in 2 days. You know, it takes some time, it's a practice, and you may begin with 5 minutes a day to cultivate that resiliency, to cultivate that mindful awareness, and strengthen your mental capability to do well in this thing. And I like to think of it, as I said earlier, as the vaccine for your soul. Just like the vaccination that you do for your body, this is the vaccination for your soul. You know, get you ready for the next stressor that you might encounter and come in. So to do a little bit at the time, practice make perfect, and understand that the way our mind works, it wanders. So one of the things that patients tell me is that, Tanya, I can't do this because my mind wanders all over the place. And I said, congratulations, you are aware of how your mind works, right? So think of it as a toddler. You take a toddler to Disneyland, to Disney World. They're going to be wandering, and it's okay. You just corral that little toddler and just come over here. And the toddler will go again, and you just come over here. That's how your mind works, okay? And be patient with yourself and not saying like, oh my gosh, I can't do this, I'm a failure, blah, blah, blah. You adding judgment to that. So in the practice, we try to do less of that and just say, okay, I'm pretty good. I'm aware of what I'm doing. I'm gonna keep at it again and again and again. And have a peer network, you know, friends, social network, people who can help you to get you on track and get you started and motivate you. Set some time and cultivate it and practice, as I said, and know that we're not going to fix everything tomorrow. So how is that related to pulmonary fibrosis? I mentioned earlier in my PH patient population, I saw a reduction in pain, anxiety, dyspnea, fatigue level in the immediate short term. And our intervention is about an hour long. It's multi-component. And they report really improvement in quality of life and have a different perspective about things. They were ready to work on palliative care. They were ready to have their durable power of attorney for healthcare, for example. They were ready to have that discussion. It can help with chronic cough and fatigue, as I said. Now, keep in mind that in the practice, we generally ask people to choose breathing as an anchor. And an anchor is a feeling or the symptom or the sensation that you want to center your awareness on. Sometimes it would be difficult for people who have difficulty breathing to focus on their breath. So there are other techniques that we usually teach so that it's not stressful for you. It's easy for people who don't have breathing problem to focus on the breath, but for us, you know, it can be challenging. It can even cause further anxiety, so we don't want to get there. What are some of the techniques? Breathing exercises, simple breathing technique to promote relaxation and mindfulness, okay? And it could be regular breathing or diaphragmatic breathing, whatever you want to choose to do. Body scan meditation, and I tend not to use this term because when I deliver mindfulness practice to patient in the hospital and I said, let's do a little body scan, patient will look at me like, no, we're not going to CT scan. So we use the term mindfulness meditation, focus on the body. But it's the same thing, you know, it requires some guidance and practice with a practitioner who can guide you through. And then the last one, for people who might have difficulty, we can use guided imagery to visualize something that is pleasant to you. If the beach is pleasant to you, we can focus on that, and you can have a good time thinking about that meditation. Before we get into practice, just a pre-practice, having a healthy mindset will help as well too. You know, Dr. Kabat-Zinn always talk about it, and he works with a lot of patients with pain problem, and he often said that if you're breathing, there are a lot more right within you than wrong within you, right? If you're breathing, you're good. You're good. More than, I don't know, 60% of you are perfect. Actually, you already are perfect. You're just not aware of it. So having that gratitude and write it down, you know, just little things that make you happy and pleasurable, you want to make a note of that. Practice acceptance. Accept things that you cannot change and focus on the things that you can change. You're not here to change the world. You're here for your mental health. If your cup's not full, nobody else is going to be full. Surround yourself with positivity. You have to seek for that, right? Because the world really presents you with a lot more negativity than what you need. But spend time with positive people. Be selective. Be aware. Be understanding of who brings you positivity, who doesn't. And limit your time with those people who often see the glass is always half empty, okay? So these are some of the things that you can practice. I think yesterday's session talked about diaphragmatic breathing, which can be really helpful in focus the contraction and relaxation of your diaphragmatic muscle, which is the biggest muscle in your body, to help the air movement up and down. And it takes some practice as well. You might want to take a picture of this and practice with that. You might be familiar with pursed lip breathing. This is the common technique teach in pulmonary rehab. And belly breathing is another type of focusing on the breathing work. But what we're going to do next is not so much about how to master this breathing technique, but more of how to be aware of the air movement within your body. Yoga poses for lung health, some seated twist position, seated cat-cow, and then, all these support pose that you may want to partake in it. So what I would like to do next, if you are ready and willing to participate, I would like to invite you to kind of sit back on your chair. You might want to scoot your chair back a little bit further so that you have space for your feet to be on the ground, and just adjust your body shape and size to get yourself back into your chair. And take a few deep breaths in and out, in and out. And just know that you are supported and you're grounded with your feet on the ground. You can feel your feet. You know where your body is. Your whole entire body is being supported by the chair. You're safe, okay? And if I can have your hands placed in front of you in the prayer position, we're going to do a little bit fountain pose, okay? As you breathe in, raise your arm up any amount as you can. You're a beautiful fountain. Okay, don't hit your neighbors, all right? And just get in the front. And repeat this position gently at your own pace. And just notice your breath. What happened with your breath when you raise your arm up, above your head and down on your side? You may choose to breathe in and breathe out. Just allow your breath to kind of guide your pose. And we're not in competition, we're just feeling how much and how high you want to move your arms, okay? Do a few more times, breathe in and sweep it down. There's no right or wrong way to do it. Just do you and I do me. And the world is a beautiful place. 2 more times, and ups and down like a fountain. And when you're done, I want you to pause and put your hands down and notice how you feel. How's your shoulder feels? How's your arm? You've done a little exercise, which is good. Next one, we're gonna pick some apples. In Buffalo, New York, we just finished picking apples. So reach your arm up, pick that apple, put in the basket in front of you. Pick more apples in front of you and down, and the apples may be on the side, right? If you pick the apples in front of you, maybe you reach a little bit in front of you and put it in the basket, wherever you might find it, and notice your breath. So you breathe in as you stretch out. Feel it. We need a few more apples. And put in the basket. Pick 2 more. That one's a little bit higher there. Yes, ma'am, great job, and put it in the basket. And when you're done, pause and just notice. Notice how your arms feel. Notice the tension you may have released in your shoulders and your arms. Now we're going to do a little bit of your neck. Sit you straight and just gently move your neck to the left side of your body and in the front. And breathe while you're doing this. Honor your breath and in the front. Gentle movement, and notice the muscle relaxation and tension in each part of your neck. We do a lot of social media and phone. This can help. And just notice, do you breathe in as you stretch out and breathe out? Just follow the pattern of your breath. Good job. To the left. Do 3 more times. And pause in the center. You did a little bit of exercise right there. It didn't really require that much. Now let's do a little bit of twisting of your toes. So just get your left foot in the right position, and you might want to move back a little bit and just circle your ankle in one direction. And if it's difficult, you can just leave it on the floor so that your heel touch the floor. And just do it purposefully and just notice. You might feel a little crackling of I'm telling you, your body talks to you, right? And then reverse the direction of that foot. And breathe. And just pay attention to your breath as you do all this activity. A lot of time we hold our breath, right? But know that when you breathe, you can even breathe your breath into your ankle. And then pause. And rest your foot, your left foot, if you did that one. And notice how is that different from your right foot. Is it different? Can you feel a little warmth? Can you feel a little circulation going? Yes. Now do the other one. And breathe. And you might want to play with the breath as far as, you might want to slow down the circular motion. And you might want to speed up, just play with it. And then reverse the direction of that angle. And breathe. And then pause. Okay. So I want to invite you to just gently close your eyes or look downward. Take a deep breath. Get your arms in a comfortable place. You might want to put your arms on top of your thighs. There's no right or wrong way. Your feet on the ground. Feel your feet touching the ground. Notice your toes, your big toes, the little toes, the arch of your feet, your ankles, the curvature of your ankles in the back. Notice the back of your legs, the arch of your knees, the back of your knees. Feel that space. Notice the fabric that touch your skin, your thighs, the heaviness of your body, the support you get from the chair, the support from the back of the chair, your hips. Notice your breath. Notice that gentle movement of your back, how your lungs expand. You may see or feel the movement of your back expanding from side to side as you breathe in and breathe out. Notice the movement of your shoulders, your arms, the connection of your arms and your body, the length of your forearms, your wrists, the palms of your hands, your fingers, your thumbs, index finger, your middle fingers, ring finger, your pinky. They're perfect. They're all here, part of you, work for you. Everything that you do today. Notice your arms as a whole. Be aware of your breath. Notice the breath moving in and out of your chest and throughout your whole entire body. Feel your neck sitting perfectly on top of your body. The back of your head, the top of your head, your hairline. Notice your forehead, your eyebrows, the soft indentation of that space between your eyebrow, the bridge of your nose, the air movement in and out of your nose. Notice the temperature of the air as it goes in. Is it a little bit colder and cooler than when it comes out? Feel the rush of air in the back of your throat. How it flows through your windpipe and open up your lungs. And it just softly recoil as you breathe out. Follow the breath and see how it coordinates with your chest movement without you telling them what to do. You may even feel your belly rise and fall as part of this breathing naturally happening. Notice any sound in your belly. Become aware of any sound, even outside the room. But you're here. You're noticing your thighs, your hands, the front of your knees, the bend of your knees, the strength of your leg muscles and the bone that support your body, the top of your feet, the sensation on top of your feet, and the sole of your feet, and the groundedness that you feel right now in this present moment. When you're ready, you may move your fingers and toes, just slight movement, and add a bigger movement. You might want to move your arms and your shoulder whenever you're ready. And we are back here in the reality of our being. Thank you for taking this time to be here with me and experience a little bit of what body scan meditation is. And these are the reminder of managing stress. The goal is not to get rid of stress. I have never figured that out. So, but we manage to live with stress, right? Exercise, and set the time aside to do enjoyable things in your life and get enough sleep. Because if you do meditation, it can also help with your sleep as well. So I want to leave you with this last slide to remind you of the things you have heard before. But, in a support group, cultivate relationships, spend time with your loved ones, and connect with others in Pulmonary Fibrosis Foundation. and find community and fun stuff to do. And I thank you for your attention, and may the light within me share with the light within you. Thank you for listening to me.